When you're a new parent, keeping your baby safe is without a doubt your #1 job. But what happens when you need to take medication while you're breastfeeding? That can be a source of some serious anxiety. So in this explainer, we're going to give you a simple, powerful tool to help you remember which medications really do need a serious conversation with your doctor.
When you're breastfeeding, everything you eat, drink, or take is a potential concern, right? And this naturally leads to one of the most important, and let's be honest, stressful questions a new mother can face. Is this safe for my baby? It's such a critical question to ask your healthcare provider. And that worry is completely understandable, because the medications you take can, in fact, be passed to your baby through your breast milk.
And let's be real, with everything else on your mind as a new parent, trying to memorize complicated drug names like tetracycline or benzodiazepines, it's a recipe for feeling completely overloaded. But what if there was a simple, kind of quirky way to keep these names right at the top of your mind for your next doctor's visit?
Okay, so we're about to introduce a surprisingly simple, and I'll admit, a pretty strange riddle to help you remember these key medications. It's a really powerful memory tool, and you know what? It all starts with one very, very simple question.
The answer, of course, is no. It's completely unsafe, right? We're going to use this core idea, this unsafe action, to anchor our memory tool for medications that are also considered unsafe to take while you're breastfeeding.
I know what you're thinking. That sentence is absolutely bizarre. But trust me, its strangeness is the secret sauce. It's what makes it so memorable. Every key word in this wacky riddle is a hook that's designed to help you recall a specific drug or a whole class of drugs.
So, let's do this. Let's break this thing down piece by piece. We're going to decode this riddle and reveal the list of medications you'll want to have a chat with your doctor about.
So, the very first clue in the riddle is the word aspirate. It says the mother can't aspirate to drive. What common medication does that sound an awful lot like?
Yep, you got it. Aspirate is our memory hook for aspirin. It's generally avoided because of a potential, though pretty rare, risk of a serious condition in babies called Ray's syndrome. Okay, that's one down. Easy enough, right?
Next up, the riddle describes the vehicle, a cycle or a lithium-powered Benz car. Now this one phrase is actually packed with clues for 4 different medications. Let's take a look.
Let's unpack that. First, cycle is our hook for tetracyclines. That's a class of antibiotics that can affect a baby's bone and tooth development. Lithium is, well, a direct match for the psychiatric drug lithium, which can pass into breast milk and potentially cause some issues. And finally, Ben's car. We split that one in 2. Benz reminds us of benzodiazepines, which can make the baby sleepy, and car points to carbamazole, an antithyroid drug.
Okay, now let's look at what's coming out of this car's exhaust pipe. The riddle says, it dares to emit fumes of sulfur and meth. This little phrase is going to give us our next set of medications.
Let's decode this part. The word dares, notice the spelling, is a hint for amiodarone, a heart medication. Sulfur actually points to 2 drug classes, sulfonamides, another type of antibiotic, and sulfonylureas, which are used for diabetes. And meth is a short and simple hook for methotrexate, a really powerful drug.
So the riddle keeps going, describing the effect of these fumes. It says they can be cytotoxic. This next clue is probably the most direct one in the entire sentence. Yeah, there are no tricks here at all. The keyword cytotoxic is a direct reminder for cytotoxic drugs. This is a class of medication, often used in chemotherapy, that's literally designed to stop cell growth, so it can be harmful to a developing infant.
All right, we're on the home stretch now. We're at the final part of our riddle, which shifts the focus over to the baby. It says the baby tries to sip her milk like a pro and close his eyes. So this little phrase gives us our final 2 drugs. Cipro is our hook for the antibiotic ciprofloxacin, and the word close points directly to clozapine, which is an antipsychotic medication. So now that we've completely decoded that weird mnemonic, let's put everything together into a clear, organized list. This is really the ultimate takeaway from our explainer.
And here it is, the complete list, all categorized for you. You'll see all the medications from our riddle right there. Now you might also spot one we added, chloramphenicol. While it's not in our little story, it's super important to be aware of because of a risk of something called gray baby syndrome. Think of this slide as your go-to reference for that doctor's visit.
We've just given you a pretty powerful memory tool. But that brings us to what is, hands down, the single most important message of this entire explainer. Please understand,
This riddle is a tool. It's to help you remember key drug names so you can have a really informed conversation with your doctor. It is absolutely not, under any circumstances, a substitute for professional medical advice.
This is the bottom line. Always consult your healthcare professional. Your doctor, your midwife, your pharmacist, they are your partners in health. They're the only ones who can look at your specific situation and recommend the absolute safest course of action for both you and your baby.
We really hope this little memory tool helps you feel more prepared and, more empowered. Because having this information, well, that's the first step toward having the right conversations and making the best decisions for your family. Thanks so much for joining us.